My name is Usal. I'm a board-certified plastic surgeon. Joint denervation is a new topic for many plastic surgeons. So we basically get these patients from usually coming from other doctors to us, call from orthopedic surgeon or from a pain management doctor or different surgeons that they did a surgery on a patient and patient is suffering from chronic joint pain. Or sometimes there are patients coming to us because they have a joint disease, inflammatory diseases, trauma, and for any reason joint is deformed and they have a chronic pain that cannot be controlled. Unfortunately, some of these patients sometimes come to us that they are addicted to these pain medications and they are trying to get off the pain medications. They want to live a normal life rather than constantly taking pain medications or getting injections to get along with their daily duties. So denervation surgery is basically finding those painful nerves around the joints and removing them so pain signal from the joint doesn't go back to brain anymore. But it's not that simple. We cannot just take the nerve out and leave the things there. This is like removing an electrical wire live and leaving out there. That's gonna cause problem, of course. So we have to connect that wire to somewhere else that the electric current doesn't give any harm to the surrounding tissues. So what we do is we denervate these joints, means that we know the anatomy, we know those nerves, and we find them and we get them connected to maybe a nearby another nerve, so brain circuit is complete. So brain doesn't get the pain sensory anymore. Brain gets a normal circuit sensation and the pain stops. So that is the basics of the denervation operation. Let's play a scenario here about how do we find out this patient is a candidate. Let's talk about knee joint. A patient comes to us, had a very successful joint replacement, knee joint replacement, but they have excruciating pain in the area that they cannot tolerate. They see their orthopedic surgeon. Most of these orthopedic surgeons are very good surgeons and they did a perfect operation. They cannot find the reason why this pain is still there because joint is replaced already. But the reason is the sensory nerves around the joint, they are inflamed, or maybe one or two of them that they're so small with bare eye you cannot see them, that they are cut and like an electrical stimulus going out into the space and causing neuroma, what we call it, is a little pain creating nerve stimulus seeds. So first step is to confirm that this joint is stable. This joint doesn't have any infection. This joint is functioning as it's supposed to function and there are no other causes to create the pain. Once those eliminated and we find that whatever the joint is replaced is not unstable, it's not loose, there's no infection there, our next step is to cure this pain temporarily with a block. What we do is we give blocks to the area where we know the pain may come and ask the patient, is this relieving your pain? And I usually do it myself and we walk them in the office. Please walk around 15 minutes, come back to me. Go up the stairs and come back to me. Tell me how is your pain? Can you do it? And many of the patients will say, I cannot go up the stairs without stopping because I'm in pain. I said, okay, go up the stairs then. And then they come, yes, I have no pain. I'm moving around. That is a sign that this patient is going to benefit from this procedure. Then the next step is to get these patients to the operating room, find those nerves, and then do the procedure that we propose is denervation procedure. And then we start the rehabilitation process, which our physical therapists help us with that. And the patient will have 3 to 6 weeks of physical therapy. And also, I always tell the patients the first 3 to 6 weeks, contrary to the belief, they may have a little bit increased pain in the area because once we reconnect those nerves to a different source and relieve it, there may be a regeneration of these nerve ends and that may cause higher stimulus. But that will very quickly fade away and patients will go back to their normal life, hopefully no pain medications at all, and return to their job and they will be satisfied.